Hi guys, it's Dr. Dehdari from the Advanced Healing Institute. I get a lot of questions in my clinic regarding meniscus tears and their treatment. So on this short video and the next two short video, I'm going to try to break this down into simple and understandable terms regarding the treatment of meniscus tears and some of the controversies associated with it. So basically your menisci are these, look at these, you have these two rubbery shaped structures, firm rubbery structures located between your femur and your tibia, your shin bone. Okay, so you have your medial meniscus and you have your lateral meniscus here. And basically what the job of the meniscus does is when you're running or when you're walking or jumping, almost any motion that you do, this axial load is pressed on your knee joint, and your menisci help transfer this axial load into a longitudinal load, dispersing it through the joint. So basically, in simple terms, you can think of the meniscus as the shock absorbers of your knee. They also provide stabilization to your knee as a result, and they help protect the lining of your cartilage on your tibia and your femur, helping prevent osteoarthritis. Now, how do you get meniscus tears? Well, in young people, usually it's because of a sudden impact injury. So for example, a football injury or a soccer clipping injury. Skiing injuries, you see meniscus tears very common in skiing injuries. Many times the meniscus tear is accompanied by a rotational force and you get other tears of other ligaments in your knee. So usually because of the high force, you can get an anterior cruciate ACL tear or a medial and lateral or lateral collateral ligament tears. In older people, it's a different story. If it's not a major trauma, usually it's because you already have some degeneration in your meniscus. And the degeneration starts from inside the meniscus, so it's really asymptomatic. But all it takes is a small injury to exacerbate that into a small tear. So usually in elder people, you have a predisposing condition, some degeneration of your meniscus, and a small trauma which causes you to have a tear. So in the next two short videos, we're going to talk about the symptoms, the types of meniscus tears, and then finally, most importantly, the treatment of meniscus tears, and try to simplify that. And thank you.